What's up, people? It is Mental Health Monday, special edition 2 for this week. Why? Because today is June 1st, World Narcissistic Abuse Awareness Day. And of course, this is brought to you by yours truly, Demetra Williams Pitts. All right, let's get this party started. Okay, before we can talk about abuse, we need to understand what narcissistic personality disorder actually is. One of several types of personality disorders is a mental condition in which people have an inflated sense of their own importance, a deep need for excessive attention and admiration, troubled relationships, a lack of empathy for others. But behind this mask of extreme confidence lies a fragile self esteem that's vulnerable to the slightest criticism. A narcissistic personality disorder causes problems in many areas of life, such as relationships, work, school, or financial affairs. People with narcissistic personality disorder may be generally unhappy and disappointed when they're not given the special favors or admiration they believe they deserve. They may find their relationships unfulfilling, and others may not enjoy being around them. Treatment for narcissistic personality disorder centers around talk therapy or psychotherapy. California-based psychologist Robert Moody, PhD. People with personality disorders as a class have a lifetime of struggles with intimate interpersonal relationships with their family, friends, and coworkers. And that's especially true for those with narcissistic personality disorder. The disorder affects anywhere from zero point 0.5 to 5% of the general U.S. population, with a greater prevalence in men than women. The percentage is low because, in order to be diagnosed, someone with NPD has to admit they have issues, which they often don't. The real problem with a narcissistic personality disorder is that the individual lacks insight into what's going on, says Dr. Mooney. They think that the problem is all about everyone else, not them. Did you know there were 4 subtypes of narcissism? Number 1, the covert narcissist, or vulnerable narcissist, the exact opposite of the stereotypical type. Instead of craving the spotlight and constant admiration, covert narcissists tend to be shy, self-effacing, hypersensitive to how others perceive them, and chronically envious. They often think their pain or suffering is worse than everyone else's, and may even believe they're the ugliest person in the room. Number 2, the cerebral narcissist. They derive their self-importance from their intellect, believing they're smarter than anyone else. Number 3, the somatic narcissist. Somatic narcissists get their self-worth from their bodies. They tend to obsess over physical appearance, including weight, and criticize others based on their appearance. And number 4, the spiritual narcissist. They use religion or spirituality to intimidate or justify harmful behaviors to others that can creep in when an individual takes an holier than thou stance, overemphasizing their level of spirituality or closeness to God. Harmful behaviors can happen when, as an example, a church leader claims they had a vision from God about someone else, or they're in a higher position to use biblical passages to control, hurt, or shame someone. Most common narcissism traits: having an inflated sense of self importance and entitlement, needing constant admiration, attention, approval, and recognition, expecting special treatment, favors, apologies, etc., exaggerating achievements and talents, will embellish facts or even outright lying, reacting negatively to criticism, being preoccupied with fantasies about power, success, and beauty, taking advantage of others, having an ability or unwillingness to recognize the needs and feelings of others, behaving in an arrogant manner, an inflated ego and sense of superiority and entitlement, showing great charm, but can quickly become irritated or angry, showing aggression when faced with a threat to their ego, unwillingness to try something for fear of defeat, a sense of alienation, emotional disconnect from others, difficulty managing emotions, just to name a few. What are the causes of narcissism? During childhood, for example, the following may increase the risk of developing narcissism: overpraising or overpampering, excessively high expectations, unpredictable care or neglect, trauma, abuse, rejection. Stress can worsen the symptoms. Environment, mismatches in parent-child relationships with either excessive adoration or excessive criticism that is poorly attuned to the child's experience. Genetics, inherited characteristics. Neurobiology, the connection between the brain and behavior and thinking. Katrina, PhD, Associate Professor of Graduate Psychology and Director of Clinical Training at Bay Path University in Connecticut, says, but a narcissistic action every now and then isn't the same as having a personality disorder. A narcissist self-absorbed and self-centered way of thinking and behaving surfaces in every area of their life, from work and friendships to family and love relationships. Researchers agree that individuals with narcissistic personality disorder have been found to have less volume of gray matter in the left anterior ocula, the part of the brain related to empathy, emotional regulation, compassion, and cognitive functioning. Scientists believe that the full onset of NPD may occur when interpersonal development is compromised. For example, being born in an oversensitive temperament, learning manipulative behavior from parents and peers, suffering from severe childhood abuse or neglect, being excessively admired, with no realistic feedback to ground a person in reality, excessive praise focused on looks or abilities. 50 to 75% of people with narcissistic personality disorder are men. 40% of people with narcissistic personality disorder also have an anxiety disorder. Complications may occur during childhood. For example, the following may increase the risk of developing narcissism: other personality disorders, depression, misuse of drugs or alcohol, anorexia. And sometimes with narcissistic personality disorder may also have a higher risk of relationship problems, difficulties at work or school, suicidal thoughts or behaviors, cardiovascular complications, higher levels of the stress hormone cortisol in the blood. An important note here: signs of cardiovascular issue may include pain or pressure in the chest, discomfort in the arms, left shoulder, elbows, jaw, or back, shortness of breath, nausea and fatigue, lightheadedness or dizziness, and cold sweats. Now that I've given an overview of what narcissistic personality disorder is, what some of the causes may be, now it's time to talk about signs of narcissistic abuse. Because there's such a low number of people that have been diagnosed with narcissistic or NPD, some of these signs may show up in your life and you may not understand why it may have happened. But here are some signs to look out for. If you experience disassociation as a survival mechanism, you walk on eggshells around this person. You put aside your basic needs and desires, sacrificing your emotional and even your physical safety to please the abuser. You develop a pervasive sense of mistrust. You experience suicidal ideation or self-harming tendencies. You self-isolate. You find yourself comparing yourself to others, often to the extent of blaming yourself for the abuse. You self-sabotage and self-destruct. You fear doing what you love and achieving success. You protect your abuser and even gaslight yourself. You struggle with health issues and somatic symptoms that represent your psychological turmoil. You can go to psychcentral.com and look up some more details on these narcissistic abuse traits. Now, I'm excited to introduce someone. Hold on. I am so very proud of this young man. I've been knowing his family the majority of my life. Stephen Sullivan is a licensed professional counselor. Is a Chicago land native. He moved between Chicago and its suburbs a lot and loves to connect with new people. He knew he wanted to be a therapist starting in the fourth grade and has a passion for helping people develop a loving relationship with themselves. Stephen has a BA in theology and for a while saw himself becoming a pastor as a way to mentor and support others, but ultimately decided that becoming a counselor would be the best way to help others of all faiths and beliefs. He got his master's, in clinical mental health counseling at Concordia University, and since then has been working in a counselor role and loves what he does. So without further ado, I have decided to ask Stephen a couple of questions, and following the questions, I asked him to speak on some of the memes that I've seen on social media. So let's get started. Thanks, Stephen.
Okay, so for the first question, do narcissists have low self esteem? Short answer, yeah, absolutely. Um, Narcissists really look at themselves as being unimportant, as being irrelevant, unworthy. I mean, they ultimately look at themselves as being a child, and that they really have to protect themselves from being seen and being harmed ultimately. Second question: can a narcissist fall in love? Narcissists are typically incapable of experiencing love. They experience comparable feelings and they'll insist that that's love. Um, when a narcissist, quote unquote, loves their partner, it's really to get their narcissistic supply. So, really, if you're in any kind of relationship with a narcissist, they really perceive you not as a loved one, but you're more of an object, or you're their resource for their narcissist supply. Narcissist supply meaning attention. How do you deal with a narcissist in your private life, or in an intimate relationship? I really can't say that there's dealing with a narcissist, not in the way that you would think. Um, in the event that you are in an intimate relationship with a narcissist, the best thing to do is to terminate that relationship as soon as possible. The narcissist intends to drain you of all of your own self loving resources. Um, they want to drain you from your self respect, from your self love. Um, they're going to do what they can to basically make you devalue yourself, because in doing so, all of your attention is going to go to that narcissist, and once again, they're going to get their narcissist supply. Um, and a narcissist in the workspace, the best thing to do in quote unquote dealing with a narcissist, I mean, I would suggest um, documentation tends to be the best way of quote unquote dealing with a narcissist. If they have any kind of request from you, um, make sure that this request is made via email, text message. I mean, make sure you have, um, yeah, like I said, make sure you have actual documentation. Limit your face to face interactions with the narcissist as much as you possibly can. Um, a narcissist in a workspace, like, they're going to do their best to take credit for your work. to discredit you, to blame you for things, exploit your weaknesses. Um, make sure that at least one or two people that you're close to at work that can kind of vouch for what you're experiencing with this narcissist. Um, how do you suggest help for a narcissist? There is no help. I mean, the thing about a narcissist is that they believe that everyone else is sick. Um, Everyone else is the problem. Everyone else needs the help. As a narcissist, there is no problem. There's no problem with me. Yeah, everyone else is the one that has the issue. I'm perfectly fine. So, long story short, really there is no helping a narcissist. They don't believe they need help. What are other personality disorders that accompany narcissism? Um, so the ones that I will say this, there are some personality disorders that look like symptoms of narcissism. Um, the ones that stand out the most, borderline personality disorder, antisocial personality disorder, and histrionic personality disorder. So all of these together, yeah, if you bundle them all together, these all look like narcissistic personality disorder. The main difference is the disorders that I just named. Um, they can you can actually seek help for those. Um, that individual will understand that they have a problem or that something's a little off, and these things can be treated. Unfortunately, with narcissistic personality disorder, there really tends not to be treatment for that. I think I read in an article some time ago, like a fraction of 1% of narcissists honestly look at themselves as being one and they will seek treatment, but that's a fraction of 1%. I think it was like 0.4% of narcissists will actually seek treatment. Um, should a person that's experiencing psychological abuse from a narcissist seek help? Absolutely. Um, a person that's going through narcissistic abuse or narcissistic abuse recovery, more than likely you're going to be presenting with complex post-traumatic stress disorder, meaning that you're re-experiencing emotions that you've been through in while you were in this relationship with a narcissist. You're re-experiencing emotions, not specific events. That's the difference between PTSD and complex PTSD. Post-traumatic stress disorder, like you're re-experiencing a specific event. Complex PTSD, you're re-experiencing emotions. Um, I mean, yeah, of course, things like talk therapy are beneficial, but when it comes to complex PTSD, research shows that EMDR therapy, eye movement desensitization, and reprocessing tends to be the most beneficial because it's helping restructure your brain. Um, Something that talk therapy necessarily won't do. I mean, it can help you vent, it can help you learn coping skills, but after going through narcissistic abuse, there's you basically have yourself in a constant fight or flight mentality, and EMDR therapy kind of helps you restructure your brain in a way that we found to be the most beneficial.
Now we're going into our true or false segment based on some memes that have been posted on Facebook and other social media platforms. And we're going to ask Stephen about three of them that I pulled from social media. The first being narcissists have two sets of rules. They demand you do all the apologizing. You respect them. You can't say anything or criticize them. You do whatever they say, and you can have feelings or express those feelings. However, none of those rules apply to them. They can do and say whatever they want, whenever they want, never apologize, be totally disrespectful, and they seem to think it's perfectly fine. The second one is, I wish the narcissist's nose would grow every time they lied, but then again, they would deny their nose was growing and say we were just imagining things. The third one is, narcissists are cowards. They push and push a lie, and then when confronted to provide evidence to verify their narrative, they change the subject, say they don't want to talk about it, or get angry that you're questioning them at all. This keeps their targets off balance and frustrated, while the lie is allowed to continue. What say ye, Stephen?
Okay, so for the second slide, we're talking true false. So the first question, the first statement, narcissists have two sets of rules. I would say true, um, and then I would say true, but um, a narcissist can apologize in a way that they will say the words. And they will only use those words if they kind of feel their supply kind of slipping away. And they will say the words to pull their supply back and to basically pull you back in. Um, and yeah, I mean, I definitely agree. Like the set of rules for narcissists that they have for others, definitely it doesn't apply to them. Um, the second, narcissists are cowards. Oh yeah, absolutely. Narcissists are terrified of being found out, and so in the event that they feel like they're on the verge of being discovered, and discovered meaning um, you're on the verge of finding out how how small they feel about themselves, they will, yeah, they will definitely invent a lie to to keep to keep this false story of themselves alive.
Okay, that was real interesting and enlightening. Okay, hopefully it helps somebody. Our next set of memes. The first one says, which is from a narcissist, I don't know what you're talking about. Actually, that means yes, I know exactly what you're talking about, but I'm enjoying playing this role to confuse you, make you second guess yourself, your reality, and to send you into visible frustration. I have all the power and control, and inside I am laughing. The second meme says, understanding the language of a narcissist. So here's the language. I love you means I want to control you. You're stupid means I know you're more intelligent than me. You're ugly, nobody wants you. Nobody will want you means you're beautiful and I feel threatened. You're worthless means I know I am not worthy of you. You're cheating means I am cheating. You're a thief means I steal. I want you back actually means I have run out of supply. Everybody hates you mean I have been slandering you. You never loved me, you used me means I have found a new supply. Watch the narcissist. A narcissist's worst nightmare is an educated empath. What say ye, Stephen? True or false?
Okay, so with slide three, yeah, I would say all of these are true. Um, with the last one, a narcissist's worst nightmare is an educated empath. Um, if I were to take a philosophical approach, I would say a narcissist's worst nightmare is actually themselves. I mean, they're constantly in a fight or flight mode because they can't let you find them out. A narcissist themselves has experienced some sort of trauma, which is triggered why they became a narcissist in the first place. So I would say they're kind of their own worst nightmare because they have their own shadow kind of lingering over them, and they can't be discovered.
Okay, our last set of true or false memes. Number one, the narcissist likes to play forgive and forget, where you forgive and forget, and they keep on doing what they're doing. Know when to stop playing. Second one, narcissists cannot be rehabilitated because by the time a narcissist becomes an adult, their personality is a permanent part of who they are. And the last one says, agreeing to remain friends with a narcissist is like staying underwater and expecting not to drown. What say ye, Stephen?
Okay, so for the fourth slide, I would agree that these are true too. Um, I want to make clear that a narcissist is an individual who themselves experienced trauma very early in their childhood, um, and that trauma kind of developed into becoming a personality disorder. It's not something that they can grow out of because their brain has basically shifted for them to be in a constant fight or flight mode. So it's really not something that they can grow out of. I mean, if you think about it, the narcissists themselves, they are sick. I mean, it's a personality disorder. It's a mental health disorder, and they are really sick, and they are sick to the point that they don't even understand that they need help. They don't understand or acknowledge that there's a problem to begin with.
Stephen, thank you so very much for joining us. And so I want to let everyone know that help is available. You can find Stephen on Psychology Today, or you can find him with inspirecounselingcenter.com. All of the information is on the screen. Stephen has also agreed to come back and talk again regarding some of the other personality disorders and their traits so that we'll all have an opportunity to have a healthy, happy mental mind. Healthy, happy mental mind. Until the next time, this is Demetra from Mental Health Monday. Holla!